Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I am your host, Samuel, and today I'm very happy to present an absolutely wonderful guest that goes by the name of Julia Greenspan. Julia is a mom, a family woman that spent 15 years in trauma with young children and ultimately transitioned to wound care. And she is the definition of authenticity. She tells it how it is, straight shooter, candid, lovely to listen to, and really makes you feel at ease. She's the kind of person you can really ask any question to, and she'll give you a straight answer. I'm so happy to bring this interview to the airwaves because her story is something that I sincerely believe everyone should hear. You know, there's a lot of misnomers out there about what it means to be in medical sales, whether you're in pharmaceutical or medical device or diagnostic testing. And I've seen there's even more misnomers or just as many misnomers within medical device and what actually happens, especially in a role like trauma. And someone like Julia kind of levels the playing field and lets you know what's really going on. So I'm not going to say any more because I don't want to spoil it. I'm going to save it for the interview. But this is definitely a must listen. You want to catch this interview. You want to listen to every word. And again, I'm so happy to bring Julia Greenspan to the airwaves. As always, we do our best to bring you guests that bring innovation to the medical sales space, that are doing things a little bit differently as they contribute and make it the great space that I believe so many people should consider jumping into. I want you to enjoy this interview. Whatever you're doing, I really want you to listen. And as always, thank you for listening to the Medical Sales Podcast. Hey, Julia, how are we doing today?
Doing awesome. How you doing, Samuel?
Fantastic. No complaints. Why don't you tell the audience who you are and what you do?
Yeah, my name is Julia Greenspan. I am a medical device rep in the Bay Area. Trauma, ortho trauma is my history, kind of like my main background. And right now I'm currently at 3M.
3M. Mm-hmm. Okay. What type of company is 3M? Just to give everybody a little bit of context.
Yeah. So 3M is interesting, right? A lot of us know them as like the tapes company and the Post-it company. You know, maybe someone watched Romeo and Michelle's high school reunion and was like, yeah, Post-its. Well, they do a lot more than that. So 3M acquired a company called KCI a couple of years ago that is sort of like the grandpa of wound care. So they have the most respected and clinically based wound vac on the market, and they have the kind of the lion's share of the market share there. And so when they acquired them, that meant that they were acquiring a really large business and they needed, you know, some solid medical device reps. And they got a lot of amazing KCI employees that came along with them. But also, you know, because of 3M's reach, they also needed to make sure that they were able to, you know, have enough sales force to tackle all the new business. And so I became part of that little fold.
Fantastic. What do you sell particularly?
Yeah, so I do wound care and wound vacs. So for patients who are like chronically ill, or if you've ever been in a trauma situation, you have someone with a large open wound, things like that can't be closed right away. There's a lot of things that they can do to sort of speed along the recovery process for that soft tissue damage. And wound vac is one of the tools in the toolbox.
Got it. And you know what? There's a lot of listeners that aren't too familiar with the med sales industry because they want to get in. And also there's, you know, people that have just been in their space for a long time. What industry did you come from to even be attracted to something like 3M?
Yeah, it was an interesting transition. So for my background, I was in the operating room for, you know, about 22 years, something like that before coming to 3M. Wow. Yeah. So I was a surgical technologist and then orthopedic trauma rep for all of that time. And what brought me to 3M was a non-compete. So I left Stryker and kind of had a choice of whether to try to stay in trauma for that year after the non-compete and, you know, deal with all that mess, or to do a new thing. And so I had a trauma partner of mine who'd left Stryker previously, and he kind of came after me a little bit for the 3M job. It was like, dude, come over here. And so, yeah, I thought because I had a trauma buddy there, I thought, you know what, why not give it a shot, try a new thing. And so, yeah, loving it so far. It's fun
That is
applying the trauma
fantastic.
mentality to wound care.
That's what I want the audience to hear. So you're 3M now. That's wound care. Give us a day in the life of a wound care rep. I mean, what is that setup even like?
Yeah, it's a lot different. So if you have, someone like me who's say used to operating room sales and surgical sales, your customer is going to be all aspects of that hospital. It's a big ecosystem, right? So you've got like, the materials management to the C-suite, to the surgeon, to the surgical tech. But at the end of the day, the way you get paid is by getting a PO. So we all know that. You go, you do your case, you get your PO, hopefully within 30 days. Cross your little fingers and your toes that you get that within 30 and get it off your list. For wound care, it's really different. So I had never done DME sales, which is durable medical equipment sales. And I really wanted to learn that side of the business since I had a year to kind of play around in different waters. And so the way DME sales works is a lot different because your customer is oftentimes more the patient. Like you're getting direct patient contact as far as I know these patients for months, which is a very, very different thing than walking into an operating room and, seeing a surgical field and walking out. Right. Now they have my cell phone number, which is, a very different situation. But thank goodness I like people. So I like the patient contact aspect. But when it comes to the actual sales cycle, it's also interesting and different because how I get paid is from insurance companies. So instead of having a very limited contact with how the payment actually happens, now I'm deeply involved in the process, including authorizations, requirements for documentation for the patient as they heal, things like that. So, as a trauma rep, I had one phone, okay? One phone to rule them all because you're on call 24/7. So who cares? Now I've got two phones, two cell phones, a fax. I've got all this other stuff because I have sensitive patient information coming to my electronic devices all day because now I'm dealing with insurance and all these new steps to the sales cycle that I didn't have before. So it's a really good learning experience.
Wow. So your account then, your call point, various types of people.
Oh, everywhere, man. I mean, it's is it a wound center for patients that are chronic wound patients, right? That are going into their, physician maybe once a week or once every few weeks. And you might see them for months, like diabetics with foot ulcers, things like that. Or maybe it's, a private physician's office. We know that sometimes there are complications from elective procedures like plastic surgery. Well, now I know those complications are owned by the physician for, 90 days after the surgery. And so if there's a complication, they kind of got to deal with it. And so for those situations, I'm a really close partner with that surgeon to make sure that we get the patient on vac therapy and get that wound healed but that's a totally different type of patient. Chronic diabetic versus an elective plastic surgery patient, totally different physicians. And it's a really interesting thing to kind of navigate and understand the different animals, of all right, this wound is going to act this way. This wound might act that way. And what are the tools in our bag to get that patient back to normal? And those are really fun because again, trauma is so in the minute and by the second and by the hour. And then you've got wound care, which is by the month. By 6 months.
Got it. So with wound care, you're creating the majority of your schedule. I mean, it's really, you have this territory you're responsible for, and you're deciding, okay, this is how I'm going to manage my day each and every day. Is that how you treat it, or is it more 9 to 5? I'm just going to make sure I'm in these areas at this time.
I think it's hard for a trauma rep to ever be 9 to 5, regardless of where you put them. It's put me in a different fish tank. I'm probably going to swim the same. Right. So for me, I keep my phone on 24/7. I know that there's some coworkers that I have that don't do that. And that is completely up to them. And that's their prerogative because 3M also has an awesome 1-800 number that's on 24/7 with clinical people. So technically, you can turn your phone off and your patients will still get the care that they need if they have a question or if they have troubleshooting or things like that. I just find that my patients appreciate having, and my surgeons too, they appreciate knowing that I'm around, even if it's a text away or something like that. And oftentimes I can mitigate a disaster a lot faster than them going through a phone tree because some of my patients are also elderly. So you have to kind of put in your head, well, can this patient actually deal with a 1-800 situation? Or do they need someone at the ready who can really help them through? Because that kind of customer service bleeds into the relationship with surgeons and prescribers, because they know when they're prescribing for my vac, they're getting me on the other side to help them catch that patient during times when they might need some support. And if I'm willing to do that, then obviously that adds a lot of value beyond, the initial.
So what does that mean? I mean, so you're really taking calls in the middle of the night for
Yeah.
really?
Yeah, you can take the girl
Wow.
out of trauma. You can't take the trauma out of the girl.
Wow.
But I
Wow.
mean, because sometimes it's something really simple. If I have a patient who's just concerned because an alarm is going off or something hurts or, what have you, I can help them troubleshoot and say,
Mhm.
all right, that sounds like you need to call your doctor. Let's
Right.
do that.
Right.
Or I can say, that's just a cute alarm that happens when you sit on the tubing. Go
Sure.
ahead and pull the tubing out for me. And they're like, oh, it's done now. Okay, great.
But it doesn't require you to go anywhere. It just requires you to land calls and explain how the stuff that you sell works.
Yeah, for the most part. So again, coming from my old world, when I got a phone call or a text message, it usually meant get up, get out of bed,
Right.
drive an hour,
Right.
go get your nails, go to the
Right.
operating room, spend 4
Right.
hours. Like,
Right.
all right, cool. I'll take a phone call from a sweet little old lady who's like got a question. That's awesome. That's easy
Right.
peasy. Like that's fine with me. But so to answer your question though, of like what's a day in the life, right? It varies. I try to, because this is such an administrative heavy job because of the insurance piece of it, I try to parse out chunks of my day. I will like set aside part of the early morning and do my admin, make sure there were no emergent orders or urgent orders that came in overnight. Things like that I really need to keep an eye on as far as
Sure.
like, hey, this needs more documentation. Hey, we need a fresh prescription for this, right? And then I usually have my anchor appointments. So anyone who's been in sales for a long time, usually we have anchor appointments set up through the
Right.
week that we sort of work around. That is fun in this job in that I can usually actually do that. So we do a
Wow.
lot of training, especially for nurses, like at home health and stuff like that. So usually they're a mix of training and in-services and then sales calls. But it's nice because in trauma, it's really hard to have a solid anchor appointment because
Absolutely.
you might get called out. So it's
Right.
yeah, like all the stars have to align where like you have coverage and it's usually a quieter day and like it has to be a really special situation to where you can like legit make all your anchor appointments.
Right. No, it makes sense. Okay, so trauma rep to wound care rep. So talk to us a little bit about what got you into trauma. In fact, let's go back. Let's go back to college.
Ooh.
Did you go into college saying, you know what, I'm going to be a trauma rep? Or, how did you find out when your graduation day, what did you know to do and why did you make that decision?
Origin story. You go deep, Samuel. I like it. I like it.
The only way to do it.
It's the only way to do it. Well, then I'll take you back to high school. How's
Okay,
that?
take us back. Take us back.
We're gonna tell you a story. No. So when I was in high school, I wanted to go to med school. That was my initial plan. I know a lot of medical device reps. That's a lot of times how we start out is we're just interested in medicine in general. And we think, all right, med school is it. Well,
Right.
I don't know about you. I didn't come from a wealthy family. And so I knew that if I went to med school, it was going to be on my own dime. And
Sure.
I was like, all right, let's see if I even like blood. Right. So my high school had an ROP program.
Mhm.
And the ROP program was essentially getting to work at the hospital for the class times after lunch, and you got credit and you could go to different departments. Most of the kids in that class used it to ditch. So that was cool. I didn't find that out until I was like partway into the program. And I was like, oh man, like I feel like I might be the only one who seriously cares about being here. The nice thing is that gave me leverage. So
Okay.
I got to go to the program director, this awesome RN named Sharon Dahar. Shout out to Sharon. And I was like, hey, does anybody ever get the operating room? Like, would you ever consider that? And she said, well, you seem like you actually want to be here. So let me go talk to some people. And I got in. So I started in the operating room when I was 15 and I was washing instruments. So I got to be a sterile processing tech during high school. And that was really great because the operating room, it was like a freestanding surgery center next to the main OR. And so I got to actually like watch surgeries in between my cleaning and picking cases. And so as a teenager, there is no better way to figure out if you want to do this than literally going and standing in surgery for hours.
Absolutely. I can imagine.
Yeah.
I can imagine.
It was awesome. And then but I like worked like a mad woman, right? So I think my class time was technically 2 hours after lunch, and I would just do it for as long as they'd let me stay. So I would just do extra. Like, I'm going to stay until the day is over. And so basically after that class, they hired me on as an employee. So it was cute. I had to get like parental supervision, like early parental permission to like work in an operating room at 15 or 16. And by that point, so that was cool. So I started install processing there, did that for a couple of years. I got to train as a surgical tech while I was in college. So I went to UC Davis. So then it was nice because I spent like probably a total of 7 years at one hospital with this big family of operating room folk who were like, this is our baby, we will help her launch her life. And so I would be like doing physics or something. And one of the anesthesiologists would be like, get over here. And he'd like put the bed in reverse Trendelenburg and be like, mu is greater than 10 theta. And he would like give me little physics lessons in the middle of surgery. It's like,
that is fantastic.
Like, you're insane and I love you and thank you, because I didn't understand that concept. So that was really cool. And then when I was graduating, it, came sort of time to decide like, hey, do I want to really apply to med school and try to go through this process? It was definitely daunting. I think a lot of us like know it's daunting. I, at the same time, right, as I was like deciding this mess, was scrubbing, obviously taking call. And I had an orthopedic trauma case pop up as a tibia nail. And it was with a system that we hadn't used before. It was the new version of the Synthes nail, their EX. And I called the rep and I was like, hey, what are we using tonight? And he goes, oh, the Synthes EX. I was like, cool. Do you have the technique guide for that? I want to study before you get here. He's like, sure. And so he sent me the PDF and it was like, I don't know, 80 pages, 90 pages. And then I just dissected what I needed, like, did a diagram of how I wanted to set up my table, threw it on the wall, and with all the pertinent information from it, and then did the case. And he's like, hey, do you have a degree? And I was like, yeah, why? And I'm graduating in like a month. And he's like, you should like look into this job. And I had no idea what he did outside the operating room. I told him, like, you're kind of a medical device pixie. Like, I don't really know what your life is like. I just know you come in here and you like, like little pixie, like with your little laser pointer telling me what to do, but I don't know what you actually do. And so he's like, at least take an interview. If I can get you an interview, would you take it? I was like, well, yeah, we'll have a conversation. So I met his boss in Monterey or Santa Cruz, somewhere around there. And it was like a hotel. And it was like a 3-hour interview. And I was like, okay, this is like an adult job then. Okay. But I did like 4 months of interviewing. And what really clinched it for me and like why ortho trauma, like I always loved orthopedics. I always loved trauma, but it's because I met my senior rep. So when I went on my first ride along with Jay Wisner, that's what did it for me, because Jay had been with Synthes, legacy Synthes, since 1981. And so it wasn't just a situation where I was going to learn orthopedics. It was, I'm going to learn trauma from one of the like OG Synthes reps who knows everyone in the country, who has worked with some of the top surgeons in California. Like, this isn't just a stepping stone. This is like, I could really learn a lot from this guy. And so that's when I really wanted it, was when I learned who my team would be.
That's amazing. That's amazing. And then you went on to have a 15-year ortho career.
Yeah. So I did like almost a decade with Synthes. I got super fortunate. I got to work in the East Bay in Oakland, which is just, I don't know, there's just something special about the East Bay. Anybody who does trauma in Oakland knows. It's I don't know. You get to work at Highland Hospital. I think you're kind of blessed. There's no place like it. I stand by that. It's like one of my favorite places on the planet. And then Kaiser Oakland is their flagship orthopedic hospital. So they got a really dynamite trauma physician who came on over there. And so between those two houses, I was busy.
What stood out about Highland that allows you to call it your favorite place?
Highland is special because it's a safety net hospital. So it's one of the hospitals in California that is state run. It catches everybody regardless of whether they can pay or not. They get the cops when they get shot. They get, the gangbangers on the street when they got shot. When they get shot, it's like you get all walks of life. Wow. And I love it because everyone is treated as an equal. So one of the most special moments in the operating room for me was watching one of my favorite traumatologists on the planet. Shout out to Swap Shah, Dr. Swapnil Shah. He's incredible.
Mhm.
I vividly remember him treating a patient like a human. And I don't mean just like, connecting with him a little bit before surgery. I mean, this patient was scared. This patient was not okay. They were clearly panicking. And anybody who has worked with traumatized folks who maybe come from an underserved population, there's a lot of distrust of authority. It's a scary thing to go to sleep with a bunch of people with scrubs around you when you don't trust the system.
Yeah. Yeah.
And
Yeah.
he like put his hand on his chest and he's like, "We're all friends here and we've got you. I've got you." And he stared him right in
Wow.
the face. Like I'm like my
Wow.
hand on your heart.
Yeah, it's
Like I'm here to
powerful.
take care of you.
That is
And like,
powerful. Mhm.
I mean, the whole room changed.
I can
And
only imagine.
there's something really special about clinicians like that who are like, I don't care if you're high. I don't care if you like
Right.
you crashed your car because you're
Right.
totally strung out. Like,
Right.
regardless of why you're here, I don't care if you like were a criminal and you're running from the
Right.
cops and you broke everything in your body. That happened a lot. People like jumping off of BART platforms and things like that.
Sure.
It didn't matter. Like, who cares? We care about you and your injury. And that's
Beautiful.
it. And that I haven't really seen at any other hospital quite the same way.
Wow. Wow. Look at that. Okay. All right. So you have this illustrious career as a trauma rep. Talk to us about you saying, you know what? I am going to stop with trauma and I'm going to look into doing something else. What was going on there?
Yeah, it's a big choice. It's scary, right? And for
Right.
me, it was that the leadership changed at Stryker. So, won't go into nitty gritty or anything, but I think that you have to look at sort of the leadership around you and say, does this fit me anymore? Like, does
Sure.
this fit my ethics, morals, values? And can I learn something? So I'm big into like, can my leadership teach me? And I think you get to that point in your career when you have to like, you're sort of interviewing them. Like,
Right.
can I keep growing with you? And so I was getting my MBA and I'm still getting my MBA, but I was doing that while I was at Stryker. And so starting to learn a lot about different leadership styles, different cultures, different ways of implementing ideas.
And that was the intro to Julia Greenspan. We spent a large part of that first interview. That was the first one. By the way, 2 parts. So that was the first part, going over her history and what brought her to where she is today. But next week, she gets into the good stuff, where we really talk about women in trauma and what that means and what that represents and all the connected topics around that. So make sure you tune in next week for part 2. Now, you might have listened to this episode. Maybe you're someone that is, you have a territory and you're looking at the calendar and you're saying, you know what? I got 4 months to make a significant difference before this year comes to an end. I was tracking well, but I know I can, if I could just figure out how to go a little bit harder, I'm going to bring it home and I could potentially experience winner circle. I could affect that many more lives through my providers. I could get a promotion and be responsible and drive other people to experience success. There's so many opportunities. How do I make this happen? Well, that's when I would say go to evolveyoursuccess.com, select improve sales performance, fill in some information, send it to us, and have a conversation with us here at Evolve Your Success. And let us show you how we can get you on the right track and get you where you want to be before this year closes. And if you're someone that's been listening and you're thinking to yourself, I want to be in trauma. Maybe you're a mother yourself and you're saying, you know what, I've always wanted to be in trauma, but I've heard that I couldn't do it. Well, guess what? You can. And if that's something that you want to do, or anyone else that wants to get into that type of space, then you need to visit evolveyoursuccess.com, select attain medical sales role, submit some information on our application, and schedule some time. And let's have a conversation here with someone at Evolve Your Success. As always, we do our best to bring you guests that are changing the medical sales space. They're making headway. They're breaking stereotypes. I wanted to say reinventing the wheel, but they're making entirely new wheels. And it's fantastic. And hopefully we can remain a part of it as long as we can here at the Medical Sales Podcast. So make sure you tune in next week for part 2 with Julia Greenspan. We're going to get into it, and I'm telling you, you got a little taste of it right now, but she's candid, she's authentic, she tells it how it is, and I'm so excited to continue the conversation. Thank you for listening to the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.